Welcome to the deep dive. Today we're plunging into canine liver health. Specifically, two things: hepatic nodular hyperplasia, HNH, and hepatocellular dysplastic hyperplasia, or HDH.
Right.
Think of this as your shortcut to understanding these without wading through complex medical texts.
Yeah, we've gone through excerpts from Canine Hepatic Hyperplasia and Dysplasia to pull out the key stuff.
Exactly. So if you want to get the lowdown quickly, but thoroughly, hopefully you'll have some aha moments. Our mission today is pretty clear. Understand the basics, the differences, and, well, why HNH and HDH matter.
What to worry about and what's maybe not so worrying.
Precisely. What could be concerning versus what's usually benign.
Okay.
Okay, let's jump in. Starting with HNH, hepatic nodular hyperplasia.
Okay, so HNH. It's generally seen as, well, a benign change. We see it in middle-aged to older dogs mostly.
Okay.
These are little growths, non-encapsulated, typically pretty small, under 2 centimeters. Though, sometimes they can get a bit bigger, maybe up to 5 centimeters, but that's less common.
Okay, can you paint a picture? Like, what do they actually look like, say, under a microscope?
Yeah, so what's interesting is even though it's hyperplasia, meaning more cells, the overall structure inside these nodules, it still looks like liver. Maybe a bit modified, a little less organized. You'll find the central veins and portal triads, but maybe spaced irregularly.
Okay.
But here's a key thing. The hepatic cords, those rows of liver cells, they stay 1 cell wide.
1 cell wide. Got it.
Yes. And the edges, the margins, are smooth. No collapse, no fibrosis, no scarring around the edges.
Ah, and that's important for telling it apart from other things.
Absolutely. That smooth margin helps distinguish it, especially from regenerative nodules where you'd expect scarring.
And the liver cells themselves, the hepatocytes, are they acting up?
Mostly, no. They look pretty similar to the surrounding liver cells. Sometimes, though, they might be storing a bit extra glycogen or fat, lipid vacuoles.
Right. But even though it's benign, why do we even talk about it? Why is it clinically relevant?
Well, it pops up on the radar mainly for 2 reasons. First, it can sometimes go along with higher liver enzymes in older dogs, especially ALP, alkaline phosphatase.
Okay.
Second, vets might spot these nodules during an ultrasound, or maybe even stumble upon them during surgery for something else entirely.
And I heard ultrasound isn't always definitive. It can be tricky to spot.
That's true. It can look different depending on, well, the nodule size, how many there are, what the rest of the liver looks like. Sometimes they're really only found when the vet actually sees the liver surface directly.
So diagnosing it sounds like it requires a bit of care. What's the key thing for getting it right?
Oh, definitely. The biopsy technique is crucial. Because it can mimic other things, you absolutely need to sample not just the nodule,
But the normal liver, too.
Exactly.
Yeah.
You need that surrounding, unaffected liver tissue for comparison. Lets the pathologist see the difference or lack thereof.
Ah, okay. So just poking the nodule with a needle might not cut it?
Precisely. A needle biopsy just hitting the nodule could be misleading. It might look like regeneration, maybe from inflammation, or even get confused with a benign tumor and adenoma if that's all you see. Context is everything.
Okay, makes sense. So if it really is just H&H, is it making the dog feel unwell?
Generally, no. H&H itself doesn't cause clinical illness. If you hear about a big nodule that's ruptured or causing blood flow issues,
And it's probably not H&H.
it's much more likely something else, probably a misdiagnosed cancer, honestly.
That's really good to know. Do we know what causes H&H? What triggers it?
That's still a bit fuzzy in dogs. People talk about maybe metabolic factors or perhaps old minor injuries healing, oddly. In humans, there's a link to areas where blood supply was cut off in FARCs, but we don't really see that same connection in dogs. So yeah, the cause remains unknown.
And for a dog owner, if their dog gets this diagnosis, H&H, what happens next? Treatment.
Usually, nope. No treatment needed for H&H itself. Like I said, if you have a big ruptured nodule, you really need to rethink that diagnosis. It points towards cancer.
Okay.
Right, so that's H&H. Now, let's shift gears to hepatocellular dysplastic hyperplasia, HDH.
HDH, okay. And this one, you mentioned it's a bit more concerning. How's it different?
It is. HDH is seen as potentially pre-neoplastic, precancerous.
Right.
And we often find these proliferative areas in dogs that also have something called glycogen-type vacuolar hepatopathy, or VH.
Okay, VH.
Yeah.
And visually, under the microscope again, what sets HDH apart from H&H?
Some key differences. Like H&H, it's not encapsulated, but the size can vary a lot more. One really crucial feature, reduced reticulin.
Reticulin.
Hey,
That's like the liver's internal scaffolding.
exactly. That delicate framework is less prominent in HDH. Also, the hepatic cords, those rows of cells, are wider, usually 2 cells thick, not 1.
2 cells thick.
And they're disorganized,
Yeah,
messier. The edges aren't smooth like H&H. They're irregular, kind of jagged or serrated, and you don't see that marginal collapse or fibrosis.
Interesting. And the cells within HDH, do they have those vacuoles like the background VH?
Generally, no. The cells within the dysplastic lesion itself usually aren't vacuolated, even if the rest of the liver is showing those VH changes.
You mentioned that strong link with glycogen type VH. How does that connection play out clinically?
It's pretty significant. HGH often shows up alongside VH, and like H&H, it can be linked to increased liver enzymes, especially ALP again, often even higher with HDH-VH.
Now that word precancerous, that's the part that probably makes owners' ears prick up.
Yes, and rightly so. It is recognized as a step towards hepatocellular carcinoma liver cancer in some dogs.
Any particular breeds?
Scottish Terriers are the classic example where this progression is well documented, but it's not exclusive to them. And there also seems to be a connection, in some cases, to increased levels of sex hormones.
Hormones. Interesting. Does HDH look different on ultrasound compared to H&H?
Like H&H, it's variable. Really depends on the size, number, and distribution of these dysplastic areas in the liver. So ultrasound alone isn't definitive.
Right. So imaging gives clues, but not the final answer.
Correct. And actually, without using special stains on the biopsy, HDH could easily be mistaken just for nodular regeneration. You really need stains for reticulin and collagen to tell them apart properly.
You mentioned HDH signs connect to the VH syndromes. What might a dog owner actually see if their dog has that underlying VH?
The signs would likely be related more to the VH itself. Things like drinking more water, urinating more, sometimes a pot-bellied appearance, or the vet might feel an enlarged liver.
Okay. And this hormone connection you mentioned, how might hormones drive HDH?
The thought is that maybe elevated sex hormones, perhaps from an imbalance in the adrenal glands like adrenal hyperplasia producing extra sex hormones, could encourage these dysplastic changes, maybe push them towards becoming cancerous in dogs that are susceptible.
So if HDH is on the table, what kind of diagnostic workup is needed?
It's usually a multi-pronged approach, looking at blood work, checking if liver enzymes like ALP or ALT are just high or if they're actually increasing over time. That trend can be worrying. Ultrasound is key, not just of the liver to watch the nodules, but also of the adrenal glands, checking their size, looking for any masses.
Right.
And sometimes tests to assess the whole pituitary adrenal system might be recommended.
And if those sex hormones are high, what then?
Well, if they're significantly elevated, say more than 2.5 times the upper limit of normal, then the vet might discuss using medications to modulate the adrenals. But, and this is important, using drugs that don't tend to increase those sex hormone levels further. So drugs like liasidrin or migotane might be considered in specific situations. Trilostane, which is commonly used for Cushing's, is generally avoided here because it can sometimes raise sex hormone levels.
That's a crucial distinction.
It is. But it's also really important to note that the specific syndrome in Scottish Terriers with HDH, it doesn't usually respond to this adrenal treatment.
So for Scotties, it's more about watching closely.
Exactly. For them, and often for others too, it becomes about surveillance, vigilant monitoring.
What does that monitoring look like?
Typically, it involves regular blood tests, maybe every 3 months or so, to track those liver enzymes, and sequential abdominal ultrasounds to see if the nodules are changing, growing, or if new ones are popping up.
This really underscores why telling these things apart, H&H, HDH, other liver issues, is so critical. How do vets differentiate them from, say, inflammation or actual tumors?
Right. The differential diagnosis list is important. So one thing is necroinflammatory liver disease or chronic hepatitis leading to regenerative nodules.
Okay.
Unlike H&H or HDH, which might be focal, this usually affects the whole liver. The nodules are irregular, different sizes, and crucially, they're separated by bands of scar tissue and collapsed liver tissue.
So clear signs of damage and repair.
Yes. Loss of the normal lobular architecture, fibrosis within the sinusoids, disorganized, wide cords. It looks quite different structurally.
And what about actual tumors, benign versus malignant?
Good question. We need to consider hepatic adenomas. They're benign. Usually an adenoma is a distinct mass, encapsulated, pushing on the normal liver. Microscopically, you might see disorganized cords, often 2 cells wide, but the cells themselves don't look very abnormal. Minimal atypia.
Okay, that's the benign one. What about carcinoma?
Hepatocellular carcinoma, the malignant one. That can be a single mass or multiple masses. Often has irregular edges, maybe partially encapsulated. The cords can be variable in width, often wider than 2 cells. And the key features are seeing different cell types than normal liver, significant cellular atypia, meaning the cells look abnormal, maybe forming weird gland-like structures, and they're usually well vascularized.
It sounds like maybe the size of the nodule gives a hint, too.
It can be a clue, yeah. As we said, H&H is typically small, maybe 2 centimeters or less. If you see lesions bigger than that.
Raises suspicion for something else.
Exactly. Makes H&H less likely, and you start thinking more about neoplasia, cancer. But again, size isn't absolute proof.
Let's quickly loop back to the standard tests. Lab work, imaging, any clear patterns there?
Well, ALP, that alkaline phosphatase, can be up in both H&H and HDH, often higher in HDH, especially with that background VH.
Right.
But other routine bloods, protein, albumin, bilirubin, cholesterol, usually normal in both conditions. Urinalysis, typically unremarkable. And bile acids, the TSBA test. Usually normal unless the liver disease is really widespread and severe, affecting overall function.
And imaging. X-rays, ultrasound.
X-rays, often normal. Maybe you'd see an enlarged liver, hepatomegaly with HDH-VH. Ultrasound, as we've said, is variable for both. H&H might even be an incidental finding at surgery, not seen on ultrasound beforehand.
So when you really need that definitive answer, it comes down to the biopsy procedures.
Absolutely. Biopsy is gold standard. Sometimes fine needle aspiration cytology can give hints you might see normal hepatocytes or cells with those VH changes, or lipid vacuoles in H&H. With HDH, maybe smaller cells with some size variation.
But aspiration isn't always enough.
Right, especially for H&H, which can be patchy. You might miss it. So ideally, you need a larger tissue sample. A core biopsy, or better yet, a sample taken via laparoscopy or open surgery, a wedge biopsy.
And getting both the lesion and normal tissue.
Crucial. And then using those special stains we talked about.
Can you just recap those special stains quickly? What do they show?
Sure. Reticulin stain shows that liver scaffolding highlights collapse, remodeling, changes at the nodule edges. Maison's trichrome stains collagen, the scar tissue, helping identify fibrosis seen in regenerative nodules. And PAS stain, with and without amylase digestion, confirms glycogen accumulation, the hallmark of that glycogen-type VH.
Okay, perfect. So let's bring this all back home. For you listening, why is understanding these differences between H&H and HGH actually useful?
Well, if you have a middle-aged or older dog, or maybe a breed known for liver issues, knowing about these possibilities helps you interpret what your vet might be telling you if they find liver nodules or, those elevated liver enzymes, especially ALP.
Right. It helps make sense of the findings and the plan.
Exactly. It helps you ask informed questions and participate in decisions about monitoring or further tests. And the big aha moment, really, is realizing that not every lump or bump found in the liver automatically means cancer.
Absolutely. It's about having that perspective. Okay, so to quickly summarize our deep dive, H&H, common, usually benign, often needs no treatment.
Right. While HDH carries that precancerous potential, especially in certain breeds or alongside vascular hepatopathy, demanding closer attention.
And the bottom line is, if liver nodules are found, working closely with your vet for an accurate diagnosis and appropriate monitoring is key.
Couldn't agree more.
Okay. And just to leave you with something to mull over, given that potential link between hormones and HDH, what other, maybe seemingly unrelated things in a dog's life, environment, diet, other health conditions might also be playing a role in these kinds of liver changes?
That's a great question to ponder.
Something to think about. Thanks for tuning into this deep dive.